And today, I think this is one of the most important topics that I&E committee should cover. Because as we get older, we all take some kind of medications, and I wanted to do this program for a long time. But we finally got to the point where we could find someone to do it. And unfortunately, Charlie Brown, who's our speaker today, is a last-minute substitute. Christine Garrigus is not able to be here, and so he's a last-minute substitute. We really appreciate it doing this on such short notice. Let me introduce Charlie Brown. He graduated from the School of Pharmacy at University of Colorado in 1964. He owned pharmacies in Santa Barbara for 22 years, and he worked with the hospice program in Santa Barbara for 20 years. And he is a geriatric consultant since 1968. That's a long time ago when Medicare just got going at 1965. And he is a board-certified geriatric pharmacist, which means a lot. So his specialty is geriatrics and older people and how older people are affected by medication. And so he's going to give you lots of good information today. He is an independent consultant working with a citrus pharmacy, and he provides pharmacy services and consultant to nursing homes and assisted living facility. And he is also a consultant to our assisted living and our SNF, skilled nursing facility. So please help me welcome Charlie Brown.
That's fine, yeah. Can you all hear me?
Can you hear?
First of all, I'm going to say I had the name first. And when I'm introduced to people and they find out what my name is, I always get a smile and a laugh like it did from you. People don't forget it. Sometimes that's good and sometimes it's bad. But
Excuse me. They're saying they can't hear you in the back. Can you? Is that as high as it goes? Can you speak closer?
can you hear me now?
Is
All
that
right.
okay? Gloria, is that okay? Yes.
Okay. I've been involved, as was said, I've been involved in geriatrics since 1968. I started servicing a nursing home out of a fluke. I had opened a pharmacy, didn't have any business. And my mother-in-law was the director of nurses in a small 130-bed facility, and she asked me if I wanted to provide some services to them, and I found I'd do anything to make a living at that time. And so I went in and met with the administrator, and the administrator happened to be a friend of my father's. And it worked out well. I started servicing part of the facility, and within 90 days I had all of the beds in that facility, and they eventually expanded it to 189 beds. And I was having such a great time doing that, I went out to get all the other business in town, which I was fortunate enough to do, and I had a great time. I met some great people in the Santa Barbara area. I was involved in hospice, and that gave me some opportunities to take care of dying people and AIDS patients. And I just, my background, all I can say is I've had fun since 1964 practicing pharmacy. And I especially have fun working in skilled nursing facilities and working with elderly patients. My wife says that getting old ain't for sissies. And I agree with her, but it sure beats the alternative. Few things, and we were discussing this earlier. I have 2 knees that need to be replaced. Some of you know what that's like. I have a rotator cuff that needs to be replaced, and I have prostate cancer. Now, if I were a Ford automobile, they would recall me and put me in the junk heap. But instead, we're working on all those, and we're resolving all those issues. So I know where a lot of you are coming from. But some of the things that I want to talk to you about are the medications we take, the different body systems that affect them, what we can do to resolve some of the issues. And I would give you some tips on how to protect yourself. First thing is, when we look at the organ systems, we have the stomach, we have the intestines, we have the kidneys, we have the liver, And all of these play an important role in taking medications and the absorption of medications. Another problem, another organ system, or not necessarily an organ system, but we have the taste buds, and our taste buds as we get older begin to diminish, and we can't distinguish taste that well. And a lot of us, or a lot of elderly patients, stop eating adequately because they can't taste the food. And we also find a lot of patients who will put excess amounts of condiments, salt, pepper, Tabasco on their food so they can taste it. It's not bad when you're taking pepper or some of the other condiments, but salt really can create a problem, because with salt your blood pressure goes up and you retain water. So it's extremely important that we use other means to flavor our foods. Our stomachs begin to get we develop hyperacidity in the stomach, and that causes some belching and some flatulence, and it causes some GERD, and it makes us not want to eat that well. And then we start watching some of the other medications we're taking, and we start taking excess medications to try and control the GERD, or the upset stomach. We take drugs like the proton pump inhibitors like Prilosec and Nexium and Protonics and all of those medications, and that will cut down on the acidity of the stomach. Now we have a problem with that, because the majority of the medications we take are meant to be absorbed in an acidic media. So if we cut down the acidity of the stomach, a lot of the medications we take aren't being absorbed. They're not being dissolved, they're not being absorbed. So it creates a problem for us. And so we have to look for other means to prevent that hyperacidity, and that may mean that we have to change our diets. There are a lot of foods that I used to eat as a younger person. I can't do it anymore. You know, it creates some problems for me. So, you know, I have to watch what I eat, as well as, you know, all of you do too.
For example?
I don't eat some of the spicier Mexican food that I used to be able to eat. I have a classmate who said I had a cast iron stomach because there wasn't a salsa that I couldn't eat. I can't do that anymore. You know, I can't eat cabbage the way I used to. I used to really enjoy it. I didn't care if it was raw or cooked. I enjoyed cabbage. Now it creates some problems for me. So there are a lot of medications that we have that cause these problems. There are a lot of foods, I'm sorry. The intestines, you know, we have intestinal flora that helps keep our intestines intact. And we find that a lot of the antibiotics we take kill that intestinal flora. And when that intestinal flora is no longer there, we have a problem absorbing some medications and absorbing some nutrients. And it also causes diarrhea. So we have that problem. I've just written a newsletter that I think they have a copy of it in the health center, but it talks about Prilosec and Levaquin, or the fluoroquinolones. And what we're seeing is a high incidence of C. difficile, or an infection, an intestinal infection, coming into the hospitals because we're using too many antibiotics and too many of the what we call PPIs, or proton pump inhibitors, and we're preventing our natural resources from fighting infection. And as a result, we're getting some superbugs. And I have a real problem with that. Our liver function begins to decrease. And when I graduated from pharmacy school, we knew that drugs worked. We didn't know how they worked. Today we know that those drugs that are metabolized by the liver, we know what the enzyme system is, and we know what some of the sub-enzyme systems are. And we know how those drugs interact. We had no idea 40 years ago what was happening. But today, as we get older, our liver function begins to decrease, and we can't metabolize the drugs as rapidly as we used to, and many times we have to reduce the doses simply because of that. Our kidney function begins to diminish, and so we can't eliminate the drugs, because probably 80% of the medications we take are eliminated through the kidneys. So if our kidneys aren't functioning properly, we're not able to eliminate those drugs. They stay in our bloodstream, and we can actually build up a toxic condition with some of the medications. Our hearing, you know, My wife says I have selective hearing. And you know, she may be right, but there are some times she mumbles and I can't hear what she says to her. But a lot of times we don't listen as acutely as we should when people try to explain to us how to take the medications, what we should watch for. So it's extremely important that if we have any hearing impairment at all, that we make sure that we question to the point where we understand or ask them to put it in writing. And then our sight begins to diminish. And sometimes they don't make glasses strong enough. But I will tell you about an incident that happened to me in Santa Barbara. I was doing some house calls for the Visiting Nurses Association. And I had a little old woman who lived by herself in an apartment and just took care of herself beautifully. The problem was she was having some drug problems. And what had happened, when she originally got her prescriptions, they were all different colors. And she knew that she took a blue one and a white one in the morning, and a yellow one in the afternoon, and a pink one in the evening. All of a sudden, they all came white. Not only did they all come white, but now they came in child-proof containers. Now, I just want you to know that sometimes my pharmacist colleagues aren't as smart as they should be. You know, I've seen patients discharged from an acute hospital that are 86 years old with a drug to treat arthritis in a child-proof container. And how much sense does that make? Because the majority of child-proof containers can't be opened by adults, but you give them to a child and they can open them in about 3 seconds. And the proof of that was that when they were first mandated, I had a colleague who was working with me, and we both had 3-year-old sons, and we put some jelly beans in some child-proof containers and gave it to them. And it didn't take them very long at all to figure out how to open that vial. So, you know, one of my favorite cartoons is Dennis the Menace walking by the bathroom, and his father, you see all the expletives coming out of his father's mouth. And Dennis says, "Dad, you want me to open the aspirin bottle for you?" You know, and that's been one of my favorite cartoons because it was so true. But this lady eventually got to the point that she couldn't open the vials, so she was breaking the vials, and she was pouring all the pills in a soup bowl. But it was fine when they were all different colors, but all of a sudden now most of them are white, and she didn't know what she was taking, and she got into a lot of trouble. So we had to get one of the visiting nurses to go in with a weekly medication box and set up her meds for her on a weekly basis. But, you know, she didn't want to ask, but it caused some confusion. And going back to the colors of medications, some of you may see that today you get a blue tablet, tomorrow it's white, and the next day it's yellow when you get your medications. And that's because most of the pharmacies are using generics today, and it depends on which manufacturer is available, because we've had so many manufacturing problems that we can't always buy from the same manufacturer. We have to change manufacturers at times, and it does cause confusion. But I want to give you this piece of advice. If you get a tablet and it doesn't look like what you've been taking before, call the pharmacy and verify. You know, we all make mistakes. We're not perfect. And I keep telling everybody that, you know what they did to the last perfect man. And, you know, so we all do make mistakes. You know, and when I talk to you about the different systems, one of the other problems we have as older individuals is that our frequency of urination becomes more frequent and more frequent. And as a result, many of us don't drink the fluids the way we should. Now, unless you're on a fluid restriction diet, you need to continue drinking fluids. You need to keep drinking that quart of water a day. You know, regardless of how frequently you have to urinate, you need to drink that. Now, the reason for that is that the majority of our drugs are water soluble. So to get into the body, they need the fluid in order to be able to go through the systems and be absorbed. But the other side of that, many of them are also fat soluble, and they get stuck in the fatty tissues in our body. Now, many of you are a lot slimmer than I am, but your ratio of fat to muscle is higher. And as a result, some medications stay in the muscular tissue for a long period of time. You need the water to help get that out of the system. Otherwise, you can build up the amount of drug that remains in the system. It's extremely important that you keep drinking a lot of fluid. Now, some people say we're going through our second childhood. You know, I had a patient when I was working in Barstow at the VA tell me, Charlie, I'm going out of this world the same way I came in. I'm bald, I don't have any teeth, and people have to change my diaper every day. You know, he was 97 years old, but he still had a great sense of humor. You know, and as you look at it, we respond to a lot of the medications the same way small children do. A lot of the medications that we take, we need to start cutting down on the dose because our bodies won't handle it. You know, I have a good friend who was an alcoholic at the age of 78 or 79. His comment to me, Charlie, I can't drink like I used to. You know, and I had to explain to him why. And it not only was it a combination of the meds he was taking, but he was quite a bit older. And you know, he was in that period of time that, you know, that alcohol affected his mind a little bit more rapidly. He didn't eat as much as he used to. He was taking other medications, and the alcohol created problems for him. But we find that instead of taking Benadryl 50 milligrams, we might be able to take 12.5 milligrams. That a lot of those medications we can get by on half the dose that the average adult takes. And it's just simply because our systems don't work as fast, it stays around in the bloodstream a lot longer, and we respond to it differently. We talk about the overuse of antibiotics. I have an old saying that if you have a cold and you take an antibiotic, it'll take you 2 weeks to get over the cold. If you don't take the antibiotic, it'll take you 14 days. There is not an antibiotic made today that will cure a cold. A cold is a virus. There are no antibiotics that will fight that virus. So it doesn't do us any good. Now, if we have COPD or we have asthma or we have related bronchial problems, then we may be put on an antibiotic to prevent a secondary infection. But for the common cold, there's no cure for it. We can treat it symptomatically, we can treat it to stop the congestion and the nasal stuffiness and all of that, but there is no antibiotic that will cure the common cold. Here again, I love cartoons, and that's why I wish I had the PowerPoint. One of my favorite cartoons, and this goes back to my college days, is a little nerd running out of the lab, and he says, "Eureka, we discovered the perfect antibiotic. It'll cure every disease known to man. There's only one problem. You have to be in perfect health to take it." You know, and that is so true. You know, we keep advancing on all the drugs that we have. We keep advancing with the antibiotics. When I got out of school, tetracycline, erythromycin, and penicillin were the antibiotics of choice. They were the new kids on the block. Nobody uses them anymore. We have to use all of the newer drugs. You can buy tetracycline, you know, a therapy of tetracycline or penicillin for $5 or $6. One of the newest antibiotics on the market, called Zyvox, costs $2,300 for a 10-day supply. You know, thank God for insurance. But you know, here again, we're creating superbugs because we're using antibiotics. We're using the newest kid on the block, and sometimes it's like killing an ant with a shotgun. You know, we really sometimes don't need the newest and best antibiotic that's out there. One of my favorite ads today is the physician walking down the hall in a hospital with his lab jacket on, and he's got a tiger at his side. And it's advertising a drug called Tigacycline. You know, it's supposed to show how strong the medicine is and everything. What a sham. You know, it's really a shame that we have to see advertisements like this. The more medications we take, the more opportunity for drug interactions. 28% of hospitalizations of the elderly is secondary to drug therapy. 28%. You know, we use more than a third of all the medications that are dispensed in the United States today. People over the age of 60 use more than a third of all the medications. They calculate that by 2020, people over the age of 60 will be taking over 50% of the drugs. That's because of all the baby boomers coming along. But we don't have a cure. We don't have a drug that cures everything. You know, I'll never forget my 5-year-old son, another Charlie Brown in the family. But he comes by it honestly, he was named after both grandfathers. But he was 5 years old, and I got up one morning and I had a sinus headache that, you know, I just couldn't shake. And, you know, for those of you who drink, it was like the morning after the night before, but there was no night before. And he said to me, "Dad, just take a pill. You have a pill to cure everything." It's a 5-year-old telling me that. Now that was back when they could advertise everything on television. You know, they advertised vitamins and cough drops and everything on the television. And that's why they can't do it anymore. It's because kids were growing up with the attitude that we had a pill to cure every illness. And we don't. Quackery. It's estimated that $10 billion a year is spent on quackery by the elderly. That's not million, that's billion. You know, all you have to do is pick up a magazine and you find a pill that'll cure everything from prostate cancer to infertility, to impotency, to tiredness, to whatever. You know, the big thing was ginkgo biloba. The one thing about ginkgo biloba is that it causes a lot of bruising. It interacts with your vascular system. It's as bad as Coumadin and as bad as aspirin when it comes to bruising. And all the studies have shown it doesn't do anything to improve your memory, except for the memory of all those people that are selling it. And they remember what the vacations are like. Over-the-counter medications, I can't emphasize enough that they're not, how can I put it bluntly or nicely? We have a lot of problems with over-the-counter medications. They are letting almost all the newer drugs go over the counter in a short period of time. And I'm going to give you one glaring example. There's a drug called Tagamet. It was the first H2 drug out for hyperacidity in the stomach. And it worked great. The problem is it interacts with drugs like Dilantin and phenobarbital and metoprolol and a lot of the antihypertensive medications that we take. And, you know, we find that patients who are taking phenobarbital would take a Tagamet, their phenobarbital level would go out of sight. The same thing was true with Dilantin. It inhibits the metabolism of a lot of these medications because it competes with the enzymes in the liver. It was a good drug in its time, and it's still good. We find new uses for that drug all the time, but it's still a very dangerous drug for people to take. You know, you take some of the sleeping medications. What you don't understand is some of these medications interfere with other medications you're taking or may react in an additive fashion and, you know, it make you drowsy. And this is where people trying to get out of bed to go to the restroom fall and break their hips because they've taken a medication that causes excessive drowsiness. So we have to be careful of all the over-the-counter drugs. They're not innocuous. They all have an effect. And we're finding more and more of those drugs are being pulled off the market. Almost all of the children's cough and cold preparations will be off the market by the end of this year. Almost all of them. Y'all thought that Tylenol was an innocuous drug. They gave it away in hospitals and they advertised that it was the safest drug that there was. Today we find liver failures on a daily basis in hospitals because patients were taking acetaminophen or Tylenol, you know, with the attitude that it didn't create any problems. It got to the point now where the federal government has deemed that no prescription drug can have more than 5 grains of acetaminophen in it, simply because it has caused so many liver problems. The over-the-counter drugs aren't without their problems. Aspirin. A lot of us take aspirin to prevent CVAs. strokes. 81 milligrams is all we need to take. That's all that's necessary. It's not necessary to take 325 milligrams. In fact, what's been shown is that we have excessive gastric bleeding if we take the higher doses of aspirin. So if we take the lower dose, the enteric-coated aspirin, we don't see nearly the amount of problems that we see with the 325. Be careful. Now, most of you are very fortunate. You have insurance that covers your meds. But those of you who don't, or those of you who think you can surf the internet and buy your medications, beware of internet pharmacies. They may say they're a Canadian pharmacy. I can tell you that, most of them are not Canadian pharmacies. Most of them put that in their name so you'll believe the drug is coming from Canada, but we find drugs coming from Bangladesh, Pakistan, and India that are not approved by, or not even looked at by our FDA. Some of those drugs are coming in and they have absolutely no ingredient in them whatsoever. So you have to be very, very cautious when you're looking at buying drugs over the internet. I would advise you not to. And I know that, Lord only knows, I know that drugs are expensive. My average prescription price in 1972 was $11. Today, the average prescription price is over $100. The prices have gone up astronomically. And I can tell you, I don't own a pharmacy anymore, but not many people do because there is no profit there. That money all goes to the manufacturer. When you're setting up your medications, if you have a hard time remembering, set your medications up in a pill organizer to remind you when you take the medications. Lord only knows, I'm the pharmacist, right? I take medications for hypertension. I take them in the morning and I take them at night. I hate to tell you, I keep a spare supply in my car because my supply is upstairs, and because of my knees, I don't like going up the stairs if I forget to take them in the morning. And there are times I forget to take them. I know better. I need a pill organizer. I've got too big an ego to use one, to be real honest with you. But if you find your memory failing, get some help and get an organizer. There's nothing wrong with it. My wife uses one. She's bought me several of them, and they sit in my drawer because of my ego. And like I said, I admit to that. When you see your physician, ask him what the drug is for. Don't be intimidated by him. And I hope nobody will take offense to this, but he's not God. He's a man or a woman just like the rest of us. And if you have a question as to why they're giving you the medication, ask them. You have that right. They have the obligation to tell you why you're taking it and what the potential side effects may be. Now, I know a lot of physicians who rely on the pharmacy to provide you with a handout sheet on medication therapy, on the side effects of it. If you really read that handout sheet, you won't take that drug. I'll give you an example. Lomotil, we use it for diarrhea, right? If you look at the package insert, it causes diarrhea. High enough dose, it'll cause diarrhea. When you look at these, and that's why you need a pharmacist involved in it, because we can temper what the package insert says. We can temper what some of the side effects are. We can also make ourselves available so that if something happens, you can call us and ask questions. My pharmacy, when I was in Santa Barbara, happened to be in the middle of 3 chain store pharmacies. I got more telephone calls from people going to the chain store pharmacies asking me about their drugs, simply because the pharmacist there didn't take enough time with them, and we did. Take a list of your medications to each physician you go to. Physician A may not know what physician B is prescribing. I had a patient in Barstow die because of that. The patient was placed on a medication for ventricular tachycardia, and another physician gave that patient digoxin for atrial fib. The two of them have an interaction. And because of that interaction, the patient died. 2 drugs, treating heart condition, killed the patient. Physicians don't always know the drug interactions, but one physician doesn't always know what the other one's prescribing. And please always tell the physician, be honest with them, tell them what you're taking, whether it's over the counter or whether it's a prescribed medication. And please, don't do bridge table diagnosing and bridge table dispensing. And what I mean by that is, don't sit over a table with some of your fellow residents and trade medications back and forth, because it can become very deleterious to do. But make sure that physicians know all the medications that you're taking. I lost a customer or a patient because of that one time. I had 2 different physicians call in 2 different sleeping medications for a patient. And I called the main physician, or the primary care physician, and told him. And the primary care physician said, well, maybe you better go someplace else to get all your prescriptions filled, because he monitors you closely. And so he did. He went somewhere else. I don't need patients like that, and I don't need a physician like that to work with. Don't believe all the ads that you see and hear on television, in newspapers, and magazines. I questioned the manufacturers about those. I said, you're advertising drugs to the public. Well, we're not advertising. These are public service announcements. We're just informing them about their drugs. Right, and that's why we see such an increase in the request for drugs from physicians, is because they've seen it on television, they've read about it in a newspaper or a magazine, and they go and ask their physician for it. I had a Kaiser physician tell me several years ago that his ticket out of an exam room was a prescription blank. The patient wouldn't let him leave until he'd written a prescription for them. My firm belief, and it always has been, that the fewer medications we take, the better off we are. And I'll give you a case in point. I had a patient in one of my nursing homes in Santa Barbara. A patient was being admitted from the acute hospital, basically in a semi-comatose condition, to stay in the nursing facility until she passed away. The physician was leaving on vacation that same day for a week's vacation, and went into the skilled facility and wrote his orders, and the orders were follow MAR, or the medication administration record, from the acute hospital. They brought the patient in, brought all her records from the acute hospital, and the nurse did exactly what the doctor ordered. She followed all the medication orders on the medication administration record. There wasn't one. He came back a week later, and that patient was ambulatory, and she went home 2 weeks later. And his comment to me was, Charlie, you're right. We're killing these patients with the medications we're giving them. We don't need necessarily to take all of the medications that we get. Now, I'm not telling you not to take the medications that your physician prescribes for you, but we don't need to go from one doctor to another doctor to another physician and ask them to take care of the same conditions somebody else we've asked previously, because we get ourselves in trouble, because every physician treats patients differently with different medications. We have probably 120 different medications to treat hypertension with. No 2 physicians prescribe the same. They all have different attitudes about the drugs. They've all had different experiences. And so, when you ask one physician and you ask another one, you'll get 2 different answers. The big joke is, if you get 5 physicians in a room to get a diagnosis, you'll get 5 opinions. And the same thing is true of pharmacists. We do the same thing. We all look at our drug therapy in a different way. The difference is, we were trained in pharmacokinetics, on how those drugs act in the body. We were trained on the chemistry of those medications. We were trained on the interaction of those medications. And most physicians do not have the background that your pharmacist does. And I'm not putting down what the physician's education is. They have a beautiful education. And they follow their patients and they see how drugs react with those patients. Pharmacists don't have that privilege, except individuals like myself who work in the nursing homes, and so we can follow patients from month to month and see how they're responding to drug therapy. But most pharmacists don't have the privilege of doing that. And the problem with that is that their knowledge is like a muscle that's tied up and begins to atrophy. And so many pharmacists who have been practicing in a chain environment or in some area where they really don't have the ability to follow patients really forget a lot of the basics that they were taught, and it's a crying shame. It really is. If you do go to a community pharmacy or to a pharmacy, talk to the pharmacist about the medications. Ask them, really what they're used for. Ask them what to be aware of. Ask them the best way to take it. Some medications need to be taken on an empty stomach. Some of them need to be taken with food. Some of our diabetic medications have to be taken with the first bite of breakfast. Not an hour before and not an hour after, but at the minute you take a bite of toast, you take that medication. So it's extremely important that we talk to people and that we let them know how to properly take those medications. We also need to realize as we get older that our vascular system doesn't work the way it used to. I liken it a little bit to when you take a warm bath and you stand up, you get a little dizzy. Y'all experience that? Well, our bodies, as we get older, and that's because the heat relaxes the vascular system in our legs. So when we stand up, all the blood goes into the legs, and it takes it about a millisecond to respond, and they close up, and the blood goes back up into the brain. Well, as we get older, we don't respond that rapidly. So, when we get up from a seated or a lying position, we need to do it gradually. When we're laying down, what you should do is sit up on the bed, dangle your feet over the side for a few minutes, stand up and hold onto the bed, and then proceed. 70% of the broken hips that we experience in the elderly are from the bed to the bathroom, because that's the most urgent drive we have. And it's something that when we wake up in the middle of the night, it's, we hurry. And it's true that in the retirement facilities and in the skilled facilities, the majority of our broken bones are from the bed to the bathroom. We talked about the quackery, and I'm going to tell you a story about, I'm saying elderly, she really, to me at the time she was, because I was in my 30s, and she was living at a retired teacher's home in Santa Barbara, and I was doing a brown bag program. And what I would do is I would go, I would give a talk, and then I would have all of them bring their meds up to me. We'd go over the medications that we're taking, and some of them had medications that had expired 5 years before, and tell them to throw them out. And this little lady in the back of the room stayed there until everybody left. And I packed up my computer, and I was getting ready to go, and she came up to me and she said, "Mr. Brown, I have a question." I said, "What's that?" She said, "I take bee pollen." I said, "Yes." She says, "Does that really help us old people?" And I said, "Well, if you think it does, it does." I said, "But there aren't any studies to show that it does." And she said, "Well, then what you're saying is that these vitamin people are just taking us old people." And I said, "Well, in many cases, we do need to take some vitamins as we get older, but there are some claims they make that have no validity." And I started walking down the hall with her, and she said, "I'm 83 years old, and my husband died 2 years ago." Okay. Went a little further, then the question came out, "Is it really an aphrodisiac?" And I have never forgotten that. And I put my arm around her and I said, "If you think it is, it will be." Yeah, but I've never forgotten that, because she waited until the last minute to ask me what was really uppermost in her mind. And my feeling right there was, God love you, and thank you for asking me, And I'll leave you with a little comment about the 3 signs of senility. Y'all know what they are? First one's loss of memory. Can't remember what the other 2 are. It's been, I like to end with that one because it's one of my favorite jokes. Because my wife says I'm there. Anyway, I'll be more than happy to answer any questions that you might have. Now, I want you to understand, I do most of my work in the nursing homes. I haven't dispensed a prescription in 15 years. I just don't work on my feet behind the counter that much anymore. But I do spend a lot of time sitting and reading patient charts. So if you have some questions, I'll be more than happy to try and answer them. Yes, sir. Okay, the question was that he's on Plavix and he had a stent put in and the doctor increased his aspirin from 81 milligrams to 325, and it's causing some gastric problems for him right now. Should he fight with the physician? My answer is yes. And not fight with him, but question him. The common, all of the studies have shown that no more than 81 milligrams of aspirin is needed. And so, the additional aspirin just creates the gastric distress. And for the most part, one of the reasons they do that is 325 milligram aspirin is dirt cheap. You can buy it for 49 cents a hundred, and the 81 milligram, which is children's, costs a whole lot more than that. But, the 81 milligram enteric-coated children's aspirin is all that's necessary. I would question it. I mean, that's me. And I get questioned all the time, but yes, I would question it. Yes, and the question, or the statement was that a lot of the newer drugs that we use for acidity cause polyps in the stomach. That I don't know about, but I do, like I said earlier, what I do know is that the combination of that with antibiotics is causing more intestinal bugs than we've ever seen. My comment is, why don't we use Maalox and Mylanta? We used to use that all the time. Admittedly, it doesn't taste as well, but the results are the same and with fewer deleterious effects. Yes, ma'am.
What do you think of statins?
What do I think of the statins?
Yeah.
Well, if used properly, they're great drugs. If, we have some side effects with them that create problems, myalgia being one of the biggest side effects of the statins, where the muscles begin to ache. And a lot of patients, as we get older, we're more sensitive to things like that. And so we need to tell our physicians about it when that happens. But the statins are great drugs. They're great as far as being cardioprotective, and we're finding now they may help in reducing Alzheimer's in patients. So, I'm a strong proponent of using statins, but I think we have to use them judiciously. And I don't know if you've seen any of the newer things, but if any of you are at 80 milligrams of any of the statins, get a hold of your doctor and say, can I cut it in half? Because all the studies are showing there's some real problems with 80 milligrams of simvastatin and some of the others.
What is a statin?
Pardon?
What is a statin?
Statins are drugs like Zocor and Pravachol and Lipitor. They're used to lower the cholesterol and triglycerides in the body. Okay, the question is that there's a warning on a lot of drugs that they cause dry mouth, and she wants to know if it's the drug itself or some ingredient in there. It's the drug itself. There are many drugs that have what we call anticholinergic effects, and they just dry up the mouth, and it creates a problem for a lot of people. There are ways around it, and that's to keep well hydrated. We have mouth sprays that you can use that will keep the mouth
That was
hydrated.
going to be my next question. Do you recommend using the spray?
Yes, I do. I have a lot of patients who are on psychotropic medications and tranquilizers, and that's one of the side effects of them. And we use the spray a lot for them because they can't get by without those medications, and the dry mouth is really a problem. I like Dr. Wolf. His publication is very valid. Sometimes he's like me, he goes a little bit too far to the extreme. But, you know, recently the article you handed me, Darvocet was pulled off the market 6 months ago. Well, back in the 70s, when the old Darvon Compound 65 was on the market, Lilly had to run an advertisement that was required by the FDA that showed that one of those capsules was no more effective than 10 grain of aspirin. You know, these drug companies come out and they sell their drugs. You know, and if you take the propoxyphene nucleus, which is the chemical in Darvocet, and you bend it, you're one connection away from being the morphine nucleus. So you're very close to to having a drug that will react very similarly to morphine. Same thing is true with tallow. We found that tallow, if you bend it properly, you can get the morphine nucleus out of it. Tallow is highly addictive. It's a good analgesic for certain people, but it creates a lot of problems. But a lot of the medications do cause dry mouth.
Joyce Curtis is going to share with you an experience she really had with all the things that Charlie Brown covered today. That, you know, is a perfect example, I think. You know, I'm a nurse and I worked with geriatric physician and geriatric pharmacist for 20 years. So this is, I think, is very important, and Joyce is willing to share. Thank you, Joyce.
Well, mine is very current, was very real. I went from a happy-go-lucky person ending up in a wheelchair. And all this time, I was taking high blood pressure medication and other medications along with it. However, my doctor, instead of checking my medications, which I trusted him for this, sent me, number one, I wore a heart monitor for 30 days. Number two, I went to a heart doctor and got all the tests in the world, including a tilt wheel test. I went to the neurologist and had needles stuck in every part of my body to see what was wrong. I went, and each time, and I'm walking slower and slower and fainting when I get up, and fainting, and I'm afraid to go out of the house because I don't know when I might faint. Now, this all happened about this year, so many of you saw me go to the wheelchair. So in the meantime, after all this was going on, I just decided I'm not going to take any medications. And I stopped. As soon as I stopped taking anything, I began to get better. I began to get stronger. I began to start walking again. I had given up. I thought I would never walk again. I didn't share that with all of you, but that was what my big fright was, that I would never walk. And so when I quit taking, each day I got a little stronger. And it turns out that I was taking high blood pressure, when in reality, my system, as he explained to us today, was not responding in the same way. My body itself had changed to, I don't even take a high blood pressure pill now. And here I was, taking a high dosage. So when all of that stopped, everything he said today was my medication. And yet I had all of these tests, which were very expensive, and all of this, which to no avail. None of them could help me. So many of you had asked me what was wrong, why I was in a wheelchair in the dining room, which was a real blow to my pride. But I just thought this is the perfect time to explain that to you. So I would just say, have the doctor check all your medications constantly. Thank you.
Thank you.
It's always nice to hear somebody corroborate what you've been trying to tell somebody. Yeah. And I want to say this, don't go out and stop taking your medication. You know, but please don't be afraid to talk to your physician about it. You know, that's what they're being paid for, is to take care of you. And it's their responsibility to make sure you're getting the right medications at the right time, at the right strength, and that you're not having problems related to those medications. Yes, ma'am?
There are too many specialists today, and each doctor sends you to another doctor, and each one comes with different medicines, and they don't know what's going on. They really don't.
That's exactly why I said every time you go see a physician, take the full list of all the medications you're taking.
But even with the medication, they don't know because they give you the newest one. This is better. And they're always afraid to take something away because in case something happens, they're afraid to be sued.
You know, and I can't argue with you there. You know, I don't know what to say about that. The only thing I can say about it is get a good primary care physician, and every once in a while take all your medications of the list to him or her. Pardon me, say, these are the medications I'm on, please review them for me. You know, I think it's an obligation they have. The question was, will some of our medications cause memory loss rather than thinking that we're coming into the throes of Alzheimer's? Yes. We have a lot of medications that cause memory loss. And sadly enough to say that, you know, we don't tolerate dementia like we used to. When I was a kid, I had an Aunt Mary that stayed with us. She was always in the back room when friends came to visit because she acted out. She didn't fit in with the rest of the family. But we didn't dope her up and overdrug her. Today we do. Today we use a lot of tranquilizers, neuroleptic drugs.
Have on there expired and it says maybe 3 months or 6 months. Why?
I can't answer that.
Oh.
And I'll tell you why. I don't know what they're using for their inventory. Some of them will have a date on there to reorder by,
Yeah.
but that's not an expiration date.
No, that isn't.
That's a date to reorder by. Some labels, and they're supposed to be clear, but there are some labels I have a difficult time finding what the expiration date is.
Well, this says expired and it tells you the date.
Yeah. I don't know what to tell you because there aren't the mail order houses are not using that many short dated products. So all I can say is it may be their policy to put short dates on them, but for the most part, even the year expiration date that we put on them in the general pharmacy sector, we put that year expiration on there because we program it in our computers. Most of the drugs that we have out there have longer expiration dates than that. And the VA has shown in their studies, and please don't keep drugs around for a long period of time, but their studies have shown that many drugs are still good 5 years after the expiration date. But I want to warn you, that does not include antibiotics. And we found drugs like tetracycline and penicillin, when they get old, they break down to products that can cause you a lot of problems. So, I can't answer that question because I'm not there, but I can say if that happens on all of your medications you're getting from them, that almost might be mislabeled. Any other questions? Yes, sir.
Dumb question, Charlie, but how about a cheapskate like me that wants to split an aspirin quarters to cut down the potency? What's your comment?
Well, if it's aspirin, not a problem. But what we found is that even when pharmacists split tablets, we don't split them exactly in half. And so, they may chip off. You may get 60% on one and 20% on the other one. And I know that some of the insurance companies are asking patients to split tablets. I have some real problems with that. With some of my patients, I provided them with pill splitters, but even when I used to use those in the pharmacy when I was dispensing, they didn't work that well. And so I just don't believe in it because you can get a higher dose one time and less of it another. When it comes to aspirin, it's not going to make that much difference. It comes with some other meds, it will. Yes, ma'am.
Is there any problem instead of taking medication, taking vitamins?
Question is that, instead of taking medication, is there a problem taking vitamins? I believe, let me backtrack. It used to be that I believed nobody needed vitamins if they ate 1 square meal a day. We don't. And so I've come to believe that we all need to take a vitamin supplement of some kind. In the 70s, we had the richest sewage in the world. Literally, the richest sewage, because B vitamins are water soluble. And man, you take a B vitamin and you urinate, and your urine is bright yellow. In fact, I'll tell you a funny story, and I love stories. I had a young lady who had in vitro fertilization, and we had to do IV therapy on her every day. And on Saturday, she got B vitamins in her IV. And when we mixed the B vitamin, it turned bright yellow. And I went in one day to pick up some of the old bags and deliver some new ones, and she said to me, "Charlie, when you run that vitamin through me, I pee yellow." I said, "Yeah." She said, "Why don't you just dump it in the toilet? Why use me?" You know, and I tell that joke because, you know, she went full term and delivered the most beautiful little boy in the world. And she and her husband were both professors at the University of California, Santa Barbara. And her husband wrote one of the neatest pieces of poetry that I've ever seen, and named everybody that had an active role in taking care of her. And in my case, it was when Charlie Brown brought the pharmacy to our home. You know, it was really a lot of fun doing it. You know, vitamins will help, but they don't take the place of medication, depending on the condition. They don't take the place. Yeah. You know, that's my, you know, here again, you know, if we all ate well and took care of ourselves, most of us wouldn't need medication at all, but we don't do that. Yes,
Do
ma'am.
you support homeopathic, natural medicines, holistic ones?
Do I support holistic and
Do they have
homeopathic?
any validity?
Do they have any validity? Some do. Some is quackery. When I first started in pharmacy, the pharmacy I worked for had a cabinet called Humphrey's Remedies. They were all homeopathic drugs. There were like 50 or 60 different types of drugs in there. Little pellets. Talk about quackery. You know, but we have found that some medications given in much lower doses are very effective. I've seen some physicians who are naturopaths who do a good job. But there are physical conditions that do require medications that we cannot substitute homeopathic or naturalistic products for. So yes, there, you know, on one hand, yes, there are some good uses for it. On the other hand, no. All right. Thank you all. I appreciated the opportunity to talk.
Thank you very much. This was one of the most comprehensive presentations I've heard, and I've been working with pharmacists for 20 years before I came here, and I think this is one of the best. Thank you very much, Charlie.